Hi everyone, this is Dr. Anushri. Today I'm going to teach you how to use the birthing ball, which is generally done during the third trimester of pregnancy. These exercises are very helpful to open up your pelvic joint, to bring mobility in your pelvic, and to improve the flexibility so that it's easier for the child to take its position and easier during the childbirth. Before you choose to start your birthing ball exercises, you must be careful about what's the size of the ball which you're sitting on. You should choose the ball to be around 65 centimeter if your height is anywhere above 5 feet 4 inch, and if your height is anywhere lesser than that, you can choose a 55 centimeter ball as well. All it matters is when you're sitting on the ball, there has to be a 90-degree angle between your hip and your knee, and make sure the knee is not above the level of your hip. It should be either in line with the hip or slightly above the knee joint. Make sure the hip is not sinking inside the ball. To begin with, we want to start first with pelvic girdle tilts. This exercise requires you to roll on the ball. It brings a nice stretch to your lower back and gives good amount of mobility to the baby who is dancing inside. Make sure you do these rolls for 10 repetitions. You need to have a good breathing control, so breathe out as you roll forward and breathe in as you roll up. Breathe out as you roll forward, breathe in as you roll up. Your second exercise can be sideways rolling of the pelvis, where you are pushing your body weight from one hip to another. You're shifting the body weight from one hip to another. You can rest your arms down, do the same exercise for at least 10 repetitions and keep good amount of breathing going. Place your one hand on the abdomen and one hand on the lower part of the rib cage, and for this exercise I want you to do deep breathing. When you breathe in, you're stretching yourself up and breathing out from the mouth. Again, you deep breathe in, pushing the hand on the rib cage out and the hand on the abdomen forward, bringing good amount of oxygenation inside you and breathing out. Come on. This opens up all the air passages inside your lungs, giving you good amount of energy and oxygenation to the baby. When we are performing these breathing exercises, make sure when you're breathing in, your rib cage is going up and outward, and when you're breathing out, you're pulling in your Kegels muscle along with your breath. That helps to engage the pelvic floor and brings good control in your pelvic area. For the next one, we are going to roll the pelvis and make small circles, making sure the hip is not moving from its place and it's just rolling on the ball, making small circles. It brings good mobility in the pelvis and gives enough space for the child to open up and accommodate and position itself downwards. The movements are done clockwise for 10 repetitions and anti-clockwise for 10 repetitions. Make sure your knee is not going too much beyond your toes when you're doing these exercises, as the movement we need is only in the pelvic region. The next video we're doing is for a pelvic girdle pain, which most of us get during the labor or even in the third trimester. This is a very good exercise to relieve your back pain and the pelvic girdle pain, where I want you to come on all fours, place both your knee down, make sure you take good amount of cushion under the knee so that the knee stays relaxed. Place both your arms on the ball and roll yourself to the left and to the right. So the pelvic remains in the place and only the upper body is the one which is rolling to the left and to the right. Make sure you have good balance when you're doing these exercises, or take support of the floor to feel a better balance. Just shift yourself from left to right. Make sure all the weight of the abdomen is pulled down by the gravity, so you have good support. Make sure you're breathing well and relaxing all the back muscles. For the next exercise, place the ball right in front of you. Be equal weight bearing on both the knees. Place one leg forward and place your hand on the ball and stretch yourself forward till your elbow joint and you come back. When you're shifting your weight forward, your body weight goes on your hand and you're coming back. You go along with the ball. All the stretch you feel is in the front of the thighs on the opposite leg, which stays on the mat. And you roll forward, feel the stretch, 1, 2, 3, 4, 5, and come back. Which is very helpful in opening the pelvic region and opening the tight adductor muscle, which is mainly the reason for your normal birth to not happen. So make sure you're keeping yourself very flexible and you're making sure the flexibility is not the reason for your normal birth to not take place. Repeat the exercise with the opposite side as well. Make sure your body weight is a little on the ball and little on the leg in the front, and feel all the stretch on the leg which is behind. The next one is a back release exercise. All you need to do is bend forward with your hand and bend backwards with your hip. But with this, there's going to be a lot of congestion happening in the area. So make sure you keep good amount of distance between the knee so the movement is very smooth and comfortable. When you come up, you breathe in. When you go down, you breathe out. This is a very helpful exercise during the labor period as well, because in your labor, if you're doing this, it helps you get the baby positioned downwards and reduces the time of your labor as well. For your next exercise, you just need to come down and to a relaxed sitting position. The ball is placed between both the knees and you can place both your hands behind. You just need to press the ball with both your knees inwards, such that you're squeezing the ball and leaving it loose. This is good to strengthen your pelvic muscles. And then also, while you're doing these exercises, I want you to pull in your Kegel muscle, which gives you some extra energy to activate the adductors. If your ball is slipping forward, you can roll it towards you and hold it with one hand. And if you're comfortable in this position, you can also place both the hands behind and just press the ball and release. Do this for count of 10, 9, 8, 7. Pull in your Kegels when you're doing this exercise. Kegels are the lower pelvic floor muscles. It's the area from where you try to pee. So you try to stop your lower pelvic muscles by squeezing them in. This is the muscle where your baby is resting. And remember that the size of the baby is growing. So the pelvic needs to be very strong now. Now to end the series with, take the ball, place it along with the wall and try coming into a malasana sitting by taking support of the ball and your feet placing down on the floor. If this position feels very difficult or unstable to you, make sure you take a small cushion and place it right under your hip. So you have nicely seated and you're relaxed in the position. I want you to take deep breaths while you're holding yourself in this position. Your back is rested on the ball and you just take a deep breath in. While you're breathing out, make sure you're pulling in your Kegels very well so you strengthen the pelvic floor, at the same time opening up the pelvic region. 10 deep breaths is all you need to maintain in this position. It helps in positioning the baby down and also releasing the stress and the labor pain during the labor period. These birthing ball exercises should be chosen to be done at least 10 minutes every day, starting from week 32. So these were your birthing ball exercises. I hope you enjoyed doing them. But make sure you remember that these exercises need to be pain-free and it needs to be recommended by your doctor. So take a session or two with your physio, learn these exercises one-on-one, and then you're good to go and do them anytime when you need or when you feel you are a little in your pubic pains or your pelvic pains or your back pains, which generally occur during the third trimester.